Hey, welcome to our explainer. Today, we're diving into something called endometritis. It's basically an inflammation that can happen inside the uterus. We're going to break down what causes it, how to spot the signs, and really get into why acting fast makes such a huge difference for your health down the road. So let's get right into it. So I want you to start by thinking of the uterus as this incredibly protected environment, right? It's a safe space designed for a pretty amazing purpose. But what happens when that protective shield gets broken and an infection sneaks in? Well, that's exactly the scenario we're unpacking today. And that condition has a name, endometritis. It's an inflammation of the endometrium, which is just the fancy term for the inner lining of the uterus, and it's almost always caused by bacteria. Now, it can be acute, meaning it hits you suddenly and feels intense, or it can be chronic, which is more of a nagging, persistent problem that just won't go away. All right, here's our roadmap. We just covered the what. Next up, we'll get into the common triggers, how to recognize those warning signs, how doctors actually diagnose it, what the path to recovery looks like, and we'll wrap up with why timing is absolutely everything. So let's ask the big question, where does this infection even come from? Figuring out the common starting points is really the first step toward being aware and maybe even preventing it. Yeah, endometritis usually doesn't just happen out of the blue. It's typically triggered when bacteria get a chance to enter the uterus, which is supposed to be a sterile environment. This can happen after childbirth. Think about it, especially a C-section, which is major surgery. It can also happen after certain pelvic procedures, like getting an IUD put in. Of course, some STIs can travel up into the uterus. And sometimes even the normal bacteria in the vagina getting out of balance can be enough to start the trouble. Okay, so we know the potential causes, but how would you actually know if you have it? Well, your body is an amazing communicator. It sends out pretty clear signals when something is off. Let's learn how to listen to what it might be trying to tell you. The first signal, and one of the most common, is a fever. This is your body's system-wide alarm bell. It's a sign that your immune system is gearing up to fight an infection somewhere. It's a general warning, but a super important one. So after that general alarm bell, things start to get more specific. Along with that fever, you'll probably start to feel pain, right in your lower abdomen or pelvis. That pain is a much more direct signal, basically your body pointing and saying, hey, the problem is right here. And the third piece of the puzzle is unusual vaginal discharge. If you see the word purulent, that's just a medical way of saying it contains pus, which is a dead giveaway for a bacterial infection. So try to remember this trio: fever, pelvic pain, and unusual discharge. When you see those together, that's a major red flag. And it's not always just those three things. You might also notice that your uterus itself feels tender to the touch. Or you could just have that general feeling of being sick and run down, what doctors call malaise. Or even experience some abnormal bleeding. All these little signals add up to create a clearer picture. So, you've recognized the signs, you've done the right thing and gone to the doctor. What's next? Let's pull back the curtain a bit and demystify the whole diagnostic process so you know how doctors get a really clear idea of what's going on. So how do they nail it down? Well, first, a physical pelvic exam can check for that uterine tenderness we just mentioned. Next step is lab work. They'll look for signs of infection in your blood, like a high white blood cell count, and they can take swabs to test for specific bacteria. And finally, they might use an ultrasound. Now, an ultrasound can't actually see the inflammation, but it's fantastic for ruling out other problems, like checking if any tissue is left behind after childbirth, which could be feeding the infection. Okay, diagnosis is in. What does recovery actually look like? Well, here's the really good news. Endometritis is very treatable. The whole key is just making sure the treatment is tailored to how severe the infection is. For the most part, there are two main tracks for treatment. If it's a milder case, a simple round of oral antibiotics that you take at home is usually enough to knock it out. But for more severe infections, especially the kind that can happen after childbirth, the treatment is more aggressive. That usually means a stay in the hospital for IV antibiotics to get that infection under control fast. And in those cases, if an ultrasound found any leftover tissue, that would also be removed to get rid of the source of the problem. And that brings us to our final, and honestly, our most critical point. Why is acting fast so important? Because when you're dealing with endometritis, getting treated early is absolutely everything when it comes to protecting your long-term health. Look, if this is left untreated, the infection doesn't just stay put. It can spread and cause some really serious damage. We're talking about things like scarring that can lead to infertility or a nasty abdominal infection called peritonitis. In the absolute worst case scenario, that bacteria can get into the bloodstream and trigger sepsis, which is a massive body-wide overreaction that is a true medical emergency. This is exactly why catching those early signs isn't just a good idea, it is essential. So, the biggest takeaway here is this: knowledge really is power. Understanding what your body is trying to tell you gives you the power to act quickly, to prevent serious issues, and to take real control of your own health. Thanks for tuning in.